In this video, we're talking about how to choose your cataract surgeon. So if you're having cataract surgery soon, then this is a video for you. So come along. If you go online and look up information about finding a good cataract surgeon, a lot of it stems around finding someone who's board certified. But when I look for a cataract surgeon, which eventually I will someday, there's a few things that I will be looking for in a cataract surgeon of my own. And in this video, we'll talk about it. I've broken it down into 5 different categories: complication management, availability, advanced skill set, good referrals, and lifetime care. Let's talk about it. Complication management. One question you can ask your surgeon is, how many cases have you performed? The average U.S. cataract surgeon probably performs about 400 surgeries a year, so it's pretty easy to calculate that most surgeons, after just a few years of practice, already have over 1,000 procedures under their belt. I know I personally have performed over 10,000 myself. And the technology for cataract surgery is so good now that even a mediocre surgeon can have fantastic results performing a routine cataract surgery. After all, cataract surgery is the most successful operation ever performed in the history of the world. However, not all surgeons can manage complications. So more important than the question of how many cases have you performed is how many complications, how and when was your last complication, and can you manage a complication should it occur? So over the past few years, I've done more second opinion consultations for other surgeons than ever before, and one of the biggest reasons for this is that their surgeon could not manage a surgical complication. And we can boil this down into 3 broad categories: zonules, or weak zonules, floppy iris syndrome, and posterior capsule rupture. Now, during cataract surgery, we don't just remove the cataract, we also replace it with a new artificial lens implant. And if there's a lack of zonular support, there's no support network or tissue space to put the new lens in. And in these cases, it's nice to know that your surgeon has a plan B or a plan C to put the new lens in. For instance, we can put a new lens in the sulcus, or we can use advanced techniques like scleral fixation to secure the lens into the eye to replace the cataract without the need for a second or third surgery. A lot of surgeons don't have the skill set to do a secondary lens if there's capsule rupture or a lack of capsule support during the surgery. So surgeons that know how to do a secondary lens implant would be the type of surgeon that I'd want to go to. Now, the chance of that happening is quite small, but when it comes to eyes, we don't want to take any chances. And if I were to go to surgery, I would want to choose a surgeon that knows how to do a secondary lens, or at least knows how to have a plan B already lined up for a secondary lens with scleral fixation. The next broad category of complication management would be a floppy iris or a small pupil. And in these cases, the surgeon has to know, or at least be familiar with some of the techniques to maintain a stable eye so that the iris doesn't get too floppy and prolapse out of the eye. When this happens, there can be iris damage. So your surgeon should be able to control the floppy iris with iris retraction devices or advanced techniques to keep the iris maintained and stable inside the eye itself. And if it does prolapse, your surgeon should also be able to repair the iris damage, or at least mitigate some of the damage, so that the patient doesn't have a lifetime of chronic glare symptoms. You can see some examples of repairing iris damage on this video, which I'll link here. And the final category that we'll talk about of complication management that I would look for in a surgeon is the problems or complications that have to do with capsule rupture or vitreous loss. And many studies say that this can be up to 4% of cataract surgeries across the board. So knowing that your surgeon can manage this issue is very important. Does your surgeon have the skill set to quickly diagnose and treat all the potentialities when this event happens, such as retinal tears or cystoid macular edema? One thing that's very reassuring to my patients is that I do have fellowship training in retina, and I can manage a lot of the potentialities that happen during any types of these complications of cataract surgery, and if there already is a pre-existing comorbidity such as macular degeneration or diabetic retinopathy, we can already manage this concomitantly with their cataract operation. So basically, in a nutshell, when it comes to complication management, is your surgeon prepared for anything? I can tell you that after spending years in a county hospital where I've managed severe trauma like gunshot wounds and stabbings, traumatic cataracts are probably the most enjoyable surgical cases that I do and a very good professional challenge that I love. And as they say, anyone can do the easy ones, but for those of us that enjoy the challenge and for those of us like myself interested in complex surgery, we thrive on complexity. And it keeps us on our feet. And it makes the standard cataract surgery a simple walk in the park. Next, number 2, availability. Will your surgeon be available to you if any problems should arise in the early postoperative period? Some practices transfer their postoperative care to a colleague or alternate eye care provider such as an optometrist. And personally, my own preference is to manage my own patients as they recover. But as a patient, you'll need to be comfortable with either style of postoperative management. And in either case, it's easy to get an urgent same-day appointment. For instance, if you wake up with eye pain 3 days after cataract surgery, can you get a hold of someone to check your eye to make sure there's no infection? Another point, many surgeons travel to the area just for surgery and are only in town part-time. This means that they likely won't be available if an emergency arises. So it's good to find a good local ophthalmologist that you can trust to take care of you for at least the first couple weeks after surgery, where the highest chance of complications occur. And category number 3, advanced skill set. Now, these are things like femto laser cataract and minimally invasive glaucoma surgery. Now, you may not need minimally invasive glaucoma surgery or MIGS, and you may decide that laser-assisted cataract surgery is not for you, but choosing a surgeon that has gone through the extra training to learn these advanced skills tells you that they are not just your average cataract surgeon. Not every surgeon learns advanced technology, nor has access to it. And finally, number 4, good referrals. Trusted friends, family, nurses. Friends and family are a good start, and if you're able to survey some of the nurses and scrub techs at a surgery center, you can get an idea about which cataract surgeons in your area have higher rates of complications such as posterior capsule rupture. And one time I had a patient call my old program director from the residency program I did my cataract surgical training at to make sure that I got the endorsement of my old program director. Now, we may not all have access to program directors across the country, but you can always ask one of the surgery nurses or surgery techs about the doctor or surgeon that you're working with. And they can give you a good idea if they work with other surgeons in the community, how they stack up, or at least how often they end up with the complications. Does the surgeon keep their cool in the operating room and work well with the staff when things go south? That's the kind of doctor I would look for. Now, this is a topic for another video, which I'll put a link to here, but not all doctors will refer you to the ophthalmologist with the lowest complication rate. There's other political and factors involved when referrals for cataract surgeons happen. And if you want to know more about that, the video will be here. And the final category, number 5, lifetime care. Some cataract surgeons refer you out or after you've recovered from surgery to a non-surgical colleague. However, after cataract surgery, other problems can arise, such as posterior capsule opacity. If you're not sure what that is, I'll put a card link to that here. Other common diseases for patients older than 60 after cataract surgery include retinal diseases such as macular degeneration, and these other problems need ongoing care and management. As a courtesy to my own cataract patients, I have an open door policy in my practice, and that means I keep an open appointment available in my daily work schedule for any of my own private cataract patients that need care, even if the patient's surgery was years ago. And this is something I'd want to look for in a cataract surgeon. I want to be reassured that if something were to happen with my eyes, maybe not right away, but even years later, that I would have a relationship with a qualified physician that I could count on to help with any future eye health concerns. What do you think? Is there something else you would add to my list? If so, write a comment below. Who knows, you may be able to help someone else watching this video make the right choice in their cataract surgeon. And until next time, I'll see you on the next video.